A splinter is something sharp stuck in your skin, such as a thin piece of wood, glass, or metal. They can be painful and could put you at risk of infection. A splinter that is near the surface of the skin can often be easily removed. To remove a splinter safely, clean the skin around the splinter with soap and water or antiseptic. Use tweezers to grasp the splinter as close to the skin as possible. Pull it out in the direction it looks like it has entered the skin. Then clean the wound again, dry it, and cover it with a plaster or dressing. If the splinter is deep in the skin and you can't remove it, or if it's near the eyes, under a fingernail or toenail, or if the skin is looking infected, you should get help from a pharmacist or your GP. It's important to be aware of the symptoms of infection, such as redness, which can be difficult to see on brown or black skin, swelling, warmth, or pus coming from the wound. To spot the warning signs and find out when you might need to get medical help, follow the link to the NHS website.